The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jarrett Chapman of Living Well joining us. Dr. Chapman, great to see you in your pink. Looks
Good
like
to,
we coordinated this.
I know. Good to see you today. Yeah,
So today we're going to talk about a condition that many people suffer with, and that's TMJ. But there are some ways that you can use something that you have there at Living Well to alleviate those symptoms.
that is correct. So, TMJ is a wear and tear on what's called the temporomandibular joint. And a
Mhm.
lot of patients suffer from pain in this joint. Sometimes it can be aggravated or exacerbated by grinding your teeth at night
Mhm.
or
Mhm.
just grinding your teeth during the day. And what we find is the masseter becomes overworked and it really gets enlarged, and these patients have a lot of issues with their teeth and also the joint. So by using Botox, we can actually go in and relax this muscle to where we ease that discomfort and that grinding that's occurring at night and even through the day. We also can put Botox in this area up in here, the temporalis muscle, which kind of helps with that clenching of the jaw.
Mm.
It is a great treatment for patients who have TMJ. And, I just was thinking, we haven't really talked about this on air, and there's a lot of people that suffer from this. And
Yeah.
it's a life changer for a lot of my patients. It's a very simple procedure. We inject straight into this muscle here with a tiny needle. Takes us maybe 2 minutes to do the whole procedure. The effect of the Botox is not experienced for 5 to 7 days after the injection, but then after that, the patient should feel a relaxation in that muscle and the tension on that joint should ease up.
I see. Okay.
And so obviously the FDA has not approved Botox for this use, but it is a muscle. We know how it responds in muscle. And so this works very well. And we're using Botox in the masseter all over the country and the temporalis to treat this condition. Problem is the insurance won't
I,
pay for it
I
because it's
was
not
going to
FDA approved,
I was
right?
going to ask about that. Yeah,
So
because
yeah.
it's not FDA approved. That's why. Okay.
Correct. The procedure for most patients, for most females, we use about 25 units on each side. For
Mhm.
males, maybe 30 units on each side when we start. We may have to escalate that dose up or down depending on the patient. But usually the average cost to the individual is around 550 for the treatment. And the reason I do say that is because I know there are a lot of people out there that suffer from this, and I realize this is not necessarily for cosmetics. And if there is someone out there that's interested, I do want them to kind of know the price so that if it would be
Sure.
beneficial to their lifestyle or to their quality of life, because I think this
Right.
is such an improvement for patients who suffer from this. So,
And
um,
how long do the results normally last?
a- around 4 months. We see with
Okay.
TMJ treatment, it lasts around 4 months. So you're talking about doing the treatment about 3 times a year. And again, the headaches that are relieved from it, the
Mhm.
saving of the teeth that we see.
Yes.
It's just a lot of benefit to the patient. So I did want to talk about, because there are other uses besides cosmetic uses for
Right.
Botox. It's one of the most studied neurotoxins on the market. It has over 5,200 clinical studies that have been performed on this molecule. It is one of the safest of the neurotoxins out there, most studied, most indications. It has, I think over 12 indications alone for medical uses,
Uh-huh.
plus the cosmetic uses that it has. So,
Because I know
um,
it's been approved for migraines, right? To treat
correct.
migraines. Okay.
Migraines, and I think now hyperhidrosis,
Uh-huh.
as well as multiple indications for bladder and esophageal issues that patients have. And
Okay.
so, and then spasticity, of course, for patients who suffer from disorders that create spasms in the muscles. Um, of interest, we treated a stroke patient who was having contracture in the arm, and we were able to treat her with Botox and
Wow.
relax the muscle enough for the therapist to continue therapy and
Oh.
get her to have more improvement. So lots of things Botox can do. It is an amazing, amazing medicine that we have today.
Oh, that is wonderful. And thank you for sharing that news with us, Dr. Chapman. We look forward to your next visit.
Thank you for having me.